Hello everyone. We are going to do chapter 48, collecting, processing, and testing blood specimens. This is actually one of 3 different lectures. You will be presented with techniques and procedures associated with venipuncture, the process of collecting blood, to obtain blood samples that will yield accurate and reliable test results. Medical assistants will use proper clinical, administrative, and communication skills. The correct method of draw and order of draw and the correct handling and processing of the sample after collection are essential components of the venipuncture procedure. When performing venipuncture, aseptic technique and standard precautions for infection control must be observed, particularly the correct handling and disposal of sharps. The KHEP competencies and learning outcomes are listed out on page 1120 in your book. Make sure that you're aware of the key terms. What are your own reactions and phobias about venipuncture or having blood drawn? What do you remember most about your last blood test? How do you feel when you're having your blood drawn? Do you watch? And why or why not? Have you had positive or negative experiences? What I want you to do is to take a few minutes and kind of think about those, and we can talk about them in class next week. So kind of have an idea, so that we can talk about it and you can explain any positive or negativities that you've had with regard to blood draws. How might you draw on your personal experiences to help patients feel comfortable with having their blood drawn? These are just some questions that to think about, not only today but also the next time that you might have to have your blood drawn. So why do we collect blood? We want to use it to determine disease and treatment. Okay. There was a time that they did what they call bloodletting. That goes back to ancient Egyptian times. And then they used to use phlebotomy historically to cure patients who had quote-unquote bad blood. Okay. So we test blood so that the provider can gain more information on how to treat the patient, gives them ideas, it gives them an avenue to determine a diagnosis. When they talk about bloodletting, blood was drained out of individuals as a treatment, which they thought would alleviate their symptoms. So now we use phlebotomy to determine the disease process that's taking place and try to determine the appropriate treatments. You as the medical assistant has a goal for accurate results. So that starts when you obtain the blood sample to perform the test, and then to be able to report the test results. If you have any breaks in these areas, it can change the reliability and accuracy of your tests. So you want to make sure that you're drawing blood in the appropriate tubes. You have to remember how you treat the patient will leave an impression. Do you want it to be a positive or negative one? You want to make sure that you're being professional at all times. Smile. Use kind words. Okay? And as you read this PowerPoint, you want to make sure that you're collecting the blood as efficiently as possible. And your role specifically as the medical assistant will depend upon what your actual duties are in the office. Maybe one day you'll be doing it, another day you won't be, and they'll have you doing something else. Okay? Bigger offices, they have their own phlebotomists that will do the drawing of the blood. If you're in a smaller office, you might be the one that does that. Along with some of the other things that we've done in lab. So You want to make sure that you're being competent in your role and that you are applying safety standards at all times. You will have direct contact with your patient, so you need to perform high quality care. Again, professionalism at all times. That positive or negative experience will be a lasting one, especially in kids. In the pediatric office, you can determine how they will later view a doctor's office visit. Okay? Smiling is a big one, not only in a pediatric office, but any office. You know, a lot of times people are so nervous, that smile kind of just makes a little bit of that go away. Going into the vessels of the circulatory system, we have arteries, arterioles, capillaries, venules, and veins. Make sure you're aware of each one of those. And then make sure you know the differences here. The arteries carry blood from the heart. They carry oxygenated blood except for the pulmonary artery. It's normally bright red in color. The elastic walls expand with the surge of blood. There are no valves. You can feel a pulse in these areas. Veins carry blood to the heart. They carry deoxygenated blood except for the pulmonary vein. They are normally dark red in color. They have thin walls. They are less elastic. They have valves, and you will not feel a pulse. Okay, so this picture kind of shows you a little bit about that. So what is the only artery that doesn't carry oxygenated blood? That will be the pulmonary artery. And the only vein that does not carry deoxygenated blood, that will be your pulmonary vein. Blood flow, as usual, I can't speak, but blood flow also regulates our body temperature. When the body gets warm, capillaries in the extremities dilate and they let off heat to cool the body. And when the body gets cold, the capillaries will constrict and less blood flow can go through, so it conserves the heat for the rest of the body. The percentage of blood in our bodies. The body contains approximately 6 liters of blood, 45% of it which is formed elements, and the remaining 55% is liquid. Now the formed elements are red blood cells, white blood cells, and platelets. Formed elements are what we call cellular components of blood. You want to remember that these formed elements make up approximately 45% of our blood, and the rest is liquid. Okay, so they go through here and they explain white blood cells, red blood cells, and platelets, their function, their formation, their size and shape, their life cycles, their numbers, and the removal or how they're excreted in the body. The liquid portion of the blood, okay, we have serum, which is a clear straw-colored liquid part of the blood drawn in the red or gold tube after it clots. It's used for many tests in the lab. It does not contain fibrinogen. So a key point to remember here is the only way to obtain serum is to allow the blood to clot. Okay? So in the red tubes, the fibrinogen is in with the clot at the bottom of the tube. Something to remember. Plasma is the fluid that provides a matrix for blood cells, electrolytes, proteins, and chemicals to travel throughout the body via the blood vessels. The liquid portion of the uncoagulated blood, it contains fibrinogen. So with plasma, the fibrinogen is in the plasma. The tubes have stuff in them so that the blood won't clot. So if you see page 840 for a picture of coagulated and uncoagulated blood tubes. Okay, so plasma must be drawn in a colored tube other than red or gold. Okay. The main difference between serum and plasma: plasma contains fibrinogen and serum does not. So when you look at this, it kind of shows you uncoagulated blood in the tube on the left, and on the right showing you clotted blood. Okay, and explains there for you that plasma is usually hazy, containing the fibrinogen. You have the buffy white coat, which is white blood cells and platelets, and then you have the red blood cells at the bottom. In the clotted blood, you've got the formed elements. Serum is at the top and the clot is at the bottom. Separating out the serum. Formed elements in the liquid portion are often separated for lab testing. So to speed the removal of serum from the tube, we'll be using the centrifuge like we did when we did the urine samples to do this, to get the sediment in the bottom. But this is how we can speed up getting the serum from the tube. Okay, so we'll use the centrifuge to do that. The spinning action causes the heavier clot to go to the bottom of the tube, and the serum will go to the top of the tube. Separating out the plasma. To produce plasma, blood must not clot. So an anticoagulant is used in the tube. A centrifuge is used to separate the formed elements from the liquid portion. The bottom layer contains the red blood cells, then the thin layer called the buffy coat, which has the white blood cells and the platelets. The top liquid layer is the plasma, and it has fibrinogen in it. Okay. On page 1145 in your book, there is a diagram that shows the buffy coat. And I do want you to remember that the plasma layer does contain fibrinogen. Okay, when we need a serum sample, it's drawn with a gold or red top tube with a serum separator gel in it. The tube must be allowed to clot. The serum separator gel separates the serum from formed cells during centrifuging and keeps them separated. Okay, you cannot use serum separator tubes for therapeutic drug monitoring. The gel may absorb the drug. Okay, and then you won't have accurate results. You can only obtain plasma if the blood is drawn in a tube with anticoagulant in the tube. The lab manual book will tell you what color tube to use for the plasma. Draw the specimen, and you must mix the tube immediately after the draw to mix the blood with the anticoagulant. Plasma is drawn off the top of the tube and used for testing or sent in another plastic tube to a reference lab. Okay. For whole blood, you have to draw, or you must draw the blood in a tube with anticoagulant in them. When we tell you that you have to mix the blood, we just want you to invert the tube to mix it, okay, several times, so up and down, okay. You want to maintain the blood at the temperature required to perform the test, and you never freeze whole blood unless the manual says so. All right. Now we have objectives for the lab. You're going to demonstrate how to palpate a vein for collection of blood. Demonstrate how to correctly draw blood using the vacuum tube system or the vacutainer, and also the butterfly and syringe methods. You'll demonstrate how to maintain a clean, sterile environment for blood collection as well. So collection of blood samples. Venipuncture is the most common method. The preferred site is the antecubital fossa, and the veins normally used are the median cubital, the basilic, cephalic, and median veins. Make sure that you know where these are located. When they aren't accessible, the veins on the back of the hand are used, but these are more painful and may require a smaller needle or butterfly system in order to be able to get that sample. The median cubital vein is used most of the time. Veins of the feet can be used, but only with a doctor's order. The reason behind that is the feet can cause clots to form, and we don't want clots traveling anywhere. Okay? We had a gentleman in our bariatric facility one time that he was so sick we couldn't get any blood out of his arms. We even tried a spot on his head. We ended up having him stand up, and I balanced him while the phlebotomist drew out of his ankle. So it can be done. It's really weird, but it can be done. Special techniques are necessary to draw from arteries and are not generally done by a medical assistant. Refer to state laws regarding that. It's not anything that we do in the state of Ohio. Venipuncture of the legs and the feet. It's an alternative site when the arms and hands are not available. You have to get the physician's permission before drawing at these sites. The act of drawing blood here may cause clots to form, and clots can dislodge and cause a blockage elsewhere in the body, which could be a very bad thing. Arterial draws. There's a special technique necessary to draw from arteries. It's used for blood gases, and again, not usually done by medical assistants. Venipuncture equipment. For the syringe and needle method, it's the oldest method out there that's known. It does not destroy the integrity of the vein. Pulling back the plunger by hand creates a vacuum and the blood is drawn into the syringe. We talked about this the other day. You want to make sure that you pull back slowly to avoid the vein collapse. If you pull it too quick, it can just collapse, and then you're nowhere. You're going to have to start over. This sometimes is used for fragile, thin, or for quote-unquote rolling veins. Okay? The 10 ml or 10 milliliter syringe would be the maximum size for a blood draw. Here's some examples of needles and syringes. You have a couple there with two different kinds of safeties. We talked about this last week too. You want to make sure you know how to activate the safety so that you can do it one-handed. Then we have the winged infusion set, or the butterfly with the safety needle. We had some of those out. I don't think I showed you how to hook those up to the syringe, but we'll do that in lab next week. Needle gauges. Most common sizes are 20, 21, and 22. Most common lengths are 1 to 1 1/4. 18 gauge is usually used in blood banking or for donation purposes. Okay. You want to use no smaller than a 23 gauge because that can cause hemolysis. But you may use a 23 gauge with a syringe draw on a butterfly system. Okay, so when we talk about needle gauges, which we really didn't get into that the other day, the larger the number, the smaller the gauge. So, and for instance, an 18 gauge is the size of a needle that they may use to do piercings with. If you have a 25 gauge needle, that's a very small size, and you would do that to give some injections to kids, for instance. If you were to do sclerotherapy or injections into veins, like to collapse them completely, to destroy them, they use 27 or 29 gauge, which are very fine. Okay, so the larger the number, the smaller the gauge, the smaller the hole. Okay, and then we talked about the other day as well, the 25 gauge is the smallest to use for drawing blood, but it's not normally used because it can cause the red blood cells to break apart. We did kind of talk about that the other day. In your video that you watched, or should have watched by now, OSHA recommends the use of the safety needles. The needles may have caps or sleeves that slide over the needle when you're finished drawing blood, and as an employee you should have some say in what type you use. Hopefully that's the case. In 1991, the ruling became effective, so whichever type you choose, you want to combine the safest equipment with the safest practices so that you get the best all-around benefit for you, your coworkers, and your patients. I think we kind of looked at some of those a little bit last week. If not, I'm sure we'll get into it this next week. So collecting blood specimens, continuing on with that, there are engineered safety devices that have been developed in response to the Needle Stick Safety and Prevention Act. So the desired characteristics of these are that they perform reliably, they're easy to use, safe and effective, they're needleless whenever we can do that, they should not have to be activated by the user or may be activated using only one hand, and once you activate the safety device, it cannot be deactivated. Okay? So the reason for this is to reduce the possibility of needle stick injuries. You might see retracting needles, hinged or sliding shields, self-blunting needles, and or retractable lancets. The evacuated tube system is often called the Vacutainer method. The Vacutainer name is actually a brand name of Becton Dickinson. It uses a double-sided needle to draw blood into the tube. The double-sided needle is the key part of that. The advantage to this is that it can draw multiple tubes of blood with only a needle stick. And I think I showed you, or at least explained some of that to you the other day. You want to make sure that you know the parts of the needle as well. Alright, so you've got the tube puncturing end that has the rubber sleeve covering the needle. You have the hub, the shaft, the end of the needle that goes into the arm or into the site is the bevel, and that is the vein puncturing end. The Vacutainer holder, OSHA strongly recommends using only one time so that the needle doesn't have to be tampered with. Each time you mess with the needle, you have a greater chance of doing what? Poking yourself. Okay? Safety needles are better in the respect that you're not doing any two-handed recapping. Okay? Your blood tubes, different tests require different types of blood specimens. Some require the blood to clot to obtain the serum, and others require whole blood or plasma in order to get what they need for the particular test. Steps to blood clotting. Some of our anticoagulants utilize the calcium, therefore it cannot be used in the clotting process. So this would be like the light blue and lavender tubes. But the way you want to draw is you want to do your uncoagulated blood first, calcium utilized blood next, prothrombin converts to thrombin, fibrinogen converts to fibrin, and then the clot forms. So a tube containing an anticoagulant removes one of these steps, thereby preventing the blood from forming. An anticoagulant is a chemical substance in the tube that prevents the clotting by removing calcium in the form of calcium salts or by inhibiting the conversion of prothrombin to thrombin. We know what anticoagulant is used in the tube by the color of the tube. Okay? Anticoagulants are identified in tubes by their color. You want to use the proper tube for the test because the wrong anticoagulant can alter the test results. So page 1136, table 48.2 in your book kind of describes some of these different tube tops. So be familiar with those. Okay. The red has no anticoagulant in it. The red-gray model top, or they call it a tiger top, they has the serum separating tube SST with a clot activator. And then it goes down through, and each one of these goes down through and tells you what it has and what the effect that it has on the specimen and what their uses are. So you want to make sure that you look those over and are familiar with those. So we have this page, and we have this page. Additives. Sometimes additives are used to improve the specimen quality or accelerate specimen processing. Some serum tubes have clot activators, which will speed up the clotting process as well. So the plain red usually has no additive. It takes longer for the clot to form. And then additives are added to the tiger top or gold to speed up the clotting process. Clot activators, you've got silica or small glass particles on the sides of the tube that initiate the clotting process. Silica particles act as the catalyst for clotting, and thrombin is a type of clot activator used for stat or immediate testing. Okay, thrombin chemically increases the speed of the clotting process. Separator gel tubes. They contain thixotropic separator gel. The gel undergoes a temporary change in viscosity during centrifugation. So when centrifuged, the gel changes to liquid and moves up the sides of the tube to engulf the clot. Okay. So the gel separates the clot and or the cells from the serum or plasma. It's most commonly the tiger top tube. She has down here that on page 845 in your book there's a picture of that. This shows you the centrifugation process before, during, when the plug formation happens, and then afterwards what the specimen will look like, okay? See table 48.2 on page 1136 for your tube guide. You need to know commonly used tube colors, their additives, and common tests drawn in them. The order of draw is important when drawing multiple tubes. Okay, we talked about that the other day because you can have some of the additives left on the needle that goes into the tubes. Next we have the standard order of draw. So you want to draw yellow first, then light blue, then the red top, red gray top, or the tiger, the green tops, lavender, and gray. So Mrs. Cook came up with, or she saw this somewhere, if you get this into your head. Young boys still get low grades. Okay. And she's got them, highlighted there, the beginning of each word, to kind of remind you of which tubes in the order you want to draw them. So some things to think about, and we'll be asking you this next week. Which vacuum tube would you use to draw a serum specimen, lavender or red, and why, and what differentiates the two? Okay, so kind of think about that this next week. You might even jot some things down. In fact, why don't you write those down and turn them into me? Okay? Tourniquets are used to constrict the flow of blood in the arm and makes the veins more prominent. It's a 1-inch rubber strip that usually works best. Okay, you'll see other products out there. Some offices may have different things. These should be replaced often, and you need to make sure that you have a non-latex alternative for patients with latex allergies. I'm sure there's a lot out there that don't have any latex in them anymore. So if it's difficult to locate someone's veins, you can use a blood pressure cuff. You can take the blood pressure first, and then the cuff is inflated slightly below the diastolic or the bottom number pressure. Once the blood is obtained, the cuff is released. I personally have not ever had to use that kind of I've never been in that kind of situation. So just keep that in mind. You can use a blood pressure cuff. You might see specimen collection trays. So if you're using a tray, it has to have a red biohazard symbol on it. Okay, because of the possibility that somebody, you could have contaminated blood there or on it or something like that, and you have to make people aware. Okay, approaching the patient requires social skills, technical skills, and administrative skills. Each one is just as important as the other. You want to greet the patient and make sure that you explain what you're going to be doing. Do not proceed unless they understand what it is exactly that you're going to do. Remember your implied consent. We talked about this the other day as far as saying that it won't hurt, especially with kids. All right, they see that needle coming at them. You could tell them a million times it doesn't hurt. They're still going to freak. And then if you tell them it isn't going to hurt and it does, you have lost every bit of integrity that you may have had with that child. Make sure you're treating your patients with empathy. Your technical skills, make sure your patient has followed any pre-test procedures such as fasting. Your goal is to perform this procedure with a minimum amount of pain to the patient. You know how important it is to get a good specimen the first time so you don't have to redraw them. Drawing with the correct method in the right tube and either test or send the specimen away properly, so important. If you need to mix your tubes, that you're inverting those. You don't want to shake them. You're going to damage cells if you do that. So you're just going to invert those tubes if they need to be mixed. Administrative skills, label the specimen tube according to your office policy. Attach the label or write on the name of the patient immediately after your blood draw. You will also need your date, time of the draw, your initials, and I believe we told you doctor's name. The doctor's name is important if you're sending it out. Okay? Prepare your supplies before the venipuncture. Place tubes and all supplies within easy reach. And always keep spare tubes close by. Tubes need to be within easy reach so you don't have to reach over the patient or take a chance at moving that needle once you've got it in the right spot. Make sure you have the right patient by asking them to state their name and date of birth. After the specimen draw, label it immediately And at a minimum, it should have patient's name, date, time, initials of the person collecting the blood. With an EHR system, you may have a barcode label to attach to the specimen prior to even doing that, okay? If you go into a room and say, "Hi, Mrs. Jones, how are you today? I need to draw some blood on you." They may not hear you or will just nod even though they may not be the right patient. They may not have been paying attention. You cannot assume. Okay? My mom did that today with her procedure. They asked her a couple questions and she just shook her head, and it wasn't a matter of a yes or no question. So make sure they answer you. You want to label your tubes before leaving the exam room. If you have the EMR system, you could have the barcoded label to affix to the blood tube. Sending to a reference lab. You want to make sure the requisition is completed correctly. Have the computer labels to attach to the tubes. Verify in the computer when the blood is drawn. And you may have an aliquot specimen that needs labeling. Aliquot samples are a portion of a specimen that has been taken for use or storage. Positioning the patient. Ask if the patient has had problems before with drawing blood. The patient should always be seated with the proper support under their arm, or have them lay down if they have a tendency to faint. Teenage boys, along with throat swabs and other things, drawing blood on them, especially if they've been fasting and they go to immediately stand up after the blood draw, are ones you have to kind of be aware of. So you might, in the course of your conversation with your patient, ask them questions that pertain to fainting and things like that, just at a minimum, okay? Selecting venipuncture sites. The antecubital region should be checked first. The median cubital vein is the primary one used. The next step would be the back of the hand. If you use the back of the hand, you want to use a smaller gauge needle, 22 or 23. These veins will have a tendency to roll. You can also use the back of the wrist. And once again, the foot and ankle only if you have permission by the physician. Now, in the antecubital area, you have the cephalic, the basilic, the median cubital, and the median veins. Okay? If you draw on the back of the hand, the 22 or 23 gauge needle are best with a 3 cc syringe. And we talked about drawing back slowly if you're doing a syringe draw. Okay? If in the end none of this works, if it's possible and the amount of blood that you need is a minimum, there's always capillary puncture. The tourniquets you want to put on to help palpate the vein easier. You want to make sure you're leaving the tourniquet on no more than 1 minute. If the tourniquet is left on too long, it will cause hemoconcentration of blood, which can lead to inaccurate test results. Okay? So hemoconcentration is increased concentration of constituents in the blood. For example, increased potassium can happen with this when in actuality it's not really that high. If they have a skin rash on their arms, for instance, apply the tourniquet over their clothes. Also, you can remove the tourniquet as soon as the blood flow is established, but when you're new at it, you may move the needle slightly and the blood may stop flowing. So, in the beginning, it's best to leave it on until you take the needle out of the arm. Okay? You do want to make sure that you remove the tourniquet just before, I guess, removing the needle. If not, you could cause a mess. The patient could bleed more. I guess I should have said it that way. A hematoma, this can happen if the tourniquet is not removed before removing the needle from the arm. Blood will be forced out of the needle hole into surrounding tissues, resulting in the hematoma. It can also develop when the needle has gone completely through the vein and then the blood leaks out up underneath. Okay? Palpating for veins. You want to palpate with the tip of your index finger. Avoid using your thumb. Okay? The vein will feel soft and bouncy. It is not a vein if you feel it pulsating. Be the reason why you do not want to use your thumb. Okay? Tendons are hard to the touch. Nerves are deep. If the patient experiences great pain, stop immediately. Okay? Areas to avoid: edematous arms, areas of scarring, areas of hematoma. Avoid the side of a mastectomy patient. If there is a double mastectomy that's been done, check with your doctor as far as where they want the blood to be drawn from. So, swollen arms, the tourniquet can cause further tissue damage. Scarring areas may cause excessive pain to the patient if you go in that area. The hematoma, we kind of talked about, can cause erroneous test results. If you can't use another site, you want to draw distal. Think about what distal is. Distal to the hematoma. Mastectomy patients, the potential for harm to the patient due to the potential for the harm to the patient due to the stoppage of the flow of the lymph fluid on the arm on the side of the mastectomy. That's why that arm should be avoided. Even when I'm recording, I have trouble. Haha. Inserting the needle into someone's vein, you want to insert with the bevel of the needle up. The needle will go in easier and the patient will experience a less amount of pain. The needle is to be inserted at a 15-degree angle to the surface of the skin. And you never, 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 never recap a needle with two hands. If you have to recap, you'll use the scoop technique, which we will show you in class. The syringe specimen collection is ideal for collecting small volumes of blood from fragile veins in the back of the hand. After obtaining the specimen, you puncture the rubber stoppers of the tubes. It's recommended to use needleless transfer devices. The tubes will fill themselves. You do not want to force them in. Okay? And you do not want to hold the tube in one hand and the syringe in another. And we will ask you why next week. Okay? Now when we talk about the tubes filling themselves, if you force too much blood into a stopper yourself, it can spray back at you and then you have a whole nother set of issues. Vacuum tube collection with a syringe. A vacuum is created when you pull on the plunger. With the vacuum tube method, the vacuum is already in the tube and will draw the blood into the tube automatically. The advantage to this is you can get multiple tubes with one needle stick. It is also the safest way to do this. And this is a Vacutainer blood transfer device. Butterfly collection system. It combines the benefits of the evacuated tube system along with a syringe, usually a 23 gauge needle with an attached plastic wings. It's used for small veins or veins that collapse. It works well on children with small veins and for those kids that have a tendency to move during a blood draw. Instead of entering a vein at a 15-degree angle, you're going to use more like a 5-degree angle with a butterfly system. The needle is threaded into the vein. and anchors it anchors the needle into the center of the vein, and you can use this with a syringe or a vacutainer. Butterfly systems are usually more expensive. Okay. The wings kind of give you a place to kind of hold the needle in place. Blood cultures are done to determine if a patient has pathogens in their blood. There's a special technique to clean the skin prior to collecting blood cultures, and this tube is drawn first. You'll use betadine rather than alcohol to clean the skin, and you'll be using sterile gloves. The blood culture tubes contain transport media to preserve any microorganisms while they are transported to the lab for setting up the culture. Now, patient reactions. You need to anticipate and respond quickly to patient issues. Loosening the tourniquet can sometimes alleviate some of the patient's pain. That's probably one of the things that you might hear the most. You don't want to avoid probing deep into someone's arm, okay? If after 2 tries you cannot get it, you need to have somebody else try it, okay? An unsuccessful puncture, you may need to change the position of the needle, turn a needle a halfway turn, advance it a little bit further, pull it back a little. You want to make sure you're always pulling the needle out slowly. If you pull it out real quick because you're frustrated and you didn't get blood right to begin with, sometimes what happens is you go through, you might go through the vein, but as you're coming out slowly, you might pick it back up, which can save the needle stick. Sometimes patients develop the hematomas, but you were still successful with that stick, okay? Now when they talk about turning the needle a half a turn, the needle opening may be up against the side of a vein, and so you can't, it won't pull the blood through. And again, moving the needle slowly can make a difference between successful and unsuccessful draws, and I explained that to you. Now, if you're not successful, you see your flash or your little bit of blood, the tube itself may not have enough vacuum in it, so you may have to try another tube. Some special considerations. You have some patients that might be at risk for uncontrolled bleeding, so you may have them hold pressure for a full 5 minutes while keeping an eye on them. You might have the difficult venipuncture. Again, if you try twice and can't get it, ask somebody else. Children, you want to ask the parent or another parent or a person to hold the patient. Try to keep the needles out of sight of the kids. Okay. The elderly, you want to speak in clear, low-pitched tones and take your time. For fainting, use a venipuncture chair. Have the patient lie down. Okay. So if you have somebody that's fainting, remove the tourniquet and then the needle. All right. You have to think of their safety. Lower the patient's head and arms. Wipe the patient's forehead and back of the neck with a cold compress if necessary. And if the patient doesn't respond, notify your physician. You can always move the patient to the floor and elevate their legs, and that will help. If you have somebody in insulin shock, the patient will become weak and shaky and break out in a cold sweat. If the personality changes and they become lethargic, check their blood sugar right away. Now, if you have a patient that has a convulsion, don't try to restrain the patient. Keep them from injuring themselves. Move away any furniture or anything else. Notify your physician. Okay? You may also run across those angry or violent patients. All right? Don't argue with them. Notify the physician, because any patient has the right to refuse to have their blood drawn. quality control for specimen collection and processing. Procedure 48.1, page 1131. This competency will be done as part of your final lab competency to determine if you can read a lab order correctly and then draw or collect the specimen in the proper manner. Section 3, capillary puncture is used when only a small amount of blood is needed and when vein access is difficult. When patient blood volume is a concern, such as in infants, you want to not perform this on edematous areas if the patient's dehydrated or if there is poor peripheral circulation. Capillary blood, we'll talk about next. A mixture of blood from arterioles, venules, capillaries, and interstitial fluid. Most instances, capillary blood is the most resembles arterial blood. There can be differences in readings between venipuncture versus capillary, so always document how the blood was obtained. For instance, venipuncture or cap puncture or finger stick, for example. Capillary puncture sites for adults. See page 1137 in your book. The middle or ring fingers are used because they're not as calloused. Sides of the fingers, not the tip. It's less painful in that area. Warming the site or slight squeezing of the site can really help with blood flow. Blood in the fingertips show glucose changes more quickly than other parts of the body, so kind of keep that in mind as well. Infants under 1 year, on page 1137, the heel is used, the lateral area. Newborns have heel sticks for the PKU testing. I went over that with you the other day. Toddlers and young children, the big toe or a finger stick, if one is needed for them. Preparing a capillary site, you want to gently massage or warm with a moist towel. Hold the area down to use the force of gravity. Use alcohol to prepare the site, but allow it to dry. Residual alcohol can result in hemolysis of the specimen and or increased pain. We kind of talked about that the other day. Now, betadine should not be used to clean a puncture site. Iodine will falsely elevate some blood chemistries. Okay. Performing the puncture, you want to puncture at the tip of the finger and slightly off center. And actually you want to, so go to the tip and go a little off center. That's where you want to puncture that. I'm reading this a couple of ways. Sorry. Then you want to wipe away that first drop of blood because it could contain tissue fluid, which also dilutes the blood drop and can also activate clotting. And then we also talked about using alcohol in that if it's not completely dry, that can alter your results as well. If massage is needed, massage the whole hand, not just the end of the finger. Don't use a scooping technique. This can damage the red blood cells, leading to hemolysis. And make sure that you're allowing a well-rounded drop of blood to form. If the blood slows, you can re-wipe the puncture site. It will dislodge the platelet plug and allow blood to flow again. Capillary tubes will fill naturally. You want to hold them horizontally. We'll show you that in lab. And we kind of showed you as far as wiping off the plug to try to get the blood flow to go again the other day with Katie. Review question: what area of the body is the main producer of our blood cells? That would be the bone marrow. Name 4 differences between arteries and veins. Arteries carry blood from the heart, carries oxygen. It's bright red in color. There are thick elastic walls. There are no valves, and they have a pulse. Veins carry blood to the heart. They are dark red in color. There are thin walls. They are less elastic, and they have valves and no pulse can be felt. What happens to capillaries and vessels when we get cold? Cold capillaries constrict and less blood flows through, so they're conserving heat for the rest of the body. And then warm capillaries will dilate and expand and try to let off heat to cool the body. Make sure you know the formed elements and what percentage of the blood is the formed elements. We have white blood cells, red blood cells, and platelets, and the percentage of the blood that's formed elements is 45. What tube do you use to draw blood for serum? Serum being the liquid portion of the blood drawn. You want to use a red or gold top tube because it is allowed to clot. Now describe the difference between serum and plasma. Serum does not have fibrinogen in it. Plasma does. Fibrinogen is at the bottom with the cells. What instrument do we use to get the formed elements to the bottom of the blood tube? I know each and every one of you will answer centrifuge if you see that question on your test. For Vacutainer blood draws, what gauges are acceptable and what length of needle? So Vacutainer is a 1-inch needle and a 22 or 21 gauge. Syringes are 1-inch needles and they're generally 23 gauge. The first step in drawing someone's blood, you want to put them at ease. I know you want your patient identifiers and you want to wash your hands because you're all good at that. But the first step when you're drawing someone's blood is to try to put them at ease. One administrative skill that's necessary when drawing blood, any of these. Correctly labeling, correctly IDing on the primary container. You want to always attach a label or write on it the name of the patient immediately after drawing the blood, because we do not want any mistakes made and the wrong test results getting to the wrong patient, which can happen. Some of the reasons why you would do a finger stick over venipuncture, the amount of blood is what? Small. So if we only need a small amount of blood, we can do that. If they don't have good veins, or if a blood volume of a patient is a concern, like infants, you might do a finger stick. Name some of the colors of the tubes and what, if any, additives are present in the tubes. And name one test that could be drawn with each tube. Plain red has no additive. Golden Tiger Top has a silicone clot activator and thixotropic gel serum separator. Blue has sodium citrate. Green, lithium heparin. Lavender has EDTA. And gray has potassium oxalate in it. And then I will ask you next week a test that could be drawn with each of those tubes. This is the end of the first lecture, and I will go into the next one.